Welcome to my series Empowered Menopause Video 2. I'm Dr. Gabrielle Francis, and in this video we're going to go deep into the symptoms of perimenopause and menopause. Some of these symptoms can make you feel very overwhelmed and not like yourself. Things like hot flashes, depression, anxiety, weight gain, low libido, all of these things plus more. We're going to talk about getting to the root causes of what's causing these symptoms and not just the superficial symptoms themselves. And don't worry, you're not crazy, you're hormonally wise, and with the right information and the right guidance, you can start to feel like yourself again. So let's go. Now let me say that perimenopause and menopause are not a disease. They're a normal phase of life that if we're lucky enough, we're all going to go through it. Now that being said, it has become quite a syndrome, and this syndrome of perimenopause and menopause are actually very, very common in Western societies where people are under a lot of stress, they're inflamed, they're eating a lot of foods that are high in toxins, and we tend to go, never recharge. So although it's not a disease, the imbalances that we see associated with it are creating a host of symptoms that are actually signs of imbalance and not actually normal, okay? Now, we can see this because in cultures where women are not under a lot of stress, or where cultures where people are living more balanced lives, we don't see the perimenopause being such a time of suffering. In general, it's like you're having your periods, then one day they stop. And believe it or not, there's not as much suffering in a lot of cultures. So this perimenopause syndrome or menopause syndrome that we associate as being almost a disease is actually quite common, but it's a sign of imbalance. And if you're experiencing those things, it's important to get to the root of what that imbalance is so that you can feel more stable and in balance and navigate this transition with ease. Perimenopause is not a disease, but it has become a syndrome in Western cultures. And that syndrome can be associated with a lot of different symptoms. Some of the symptoms that we see are irregular cycles, hot flashes, anxiety, depression, insomnia, weight gain, mood swings, and so many other different things that make us feel uncomfortable. As a matter of fact, most women, by the time they get into their 40s, anything that's going wrong, they blame it on their hormones, don't they? Well, it is important to know that even though those symptoms are common, they're not actually normal, okay? In medicine, what we kind of consider normal is what the average population has. Even though these are common and very much seen in our society, they're not really a sign of balance. They're telling our body's telling us that we have some imbalances and that we need to understand what those imbalances are so we can start to correct them. So I'm going to start talking about some of the symptoms of perimenopause, what the root causes of them are, and how we can navigate them. Often in perimenopause, we see irregular cycles, hot flashes, and night sweats. And I want to tell you a little bit about what causes this. So the hormone levels are fluctuating quite a bit, and often the egg numbers are starting to kind of dwindle. Sometimes a woman will ovulate twice in a month. Sometimes she'll skip a month. Sometimes she'll ovulate from one side of her ovary and not the other ovary. So that creates a lot of hormone ups and downs. And it's the hormone ups and downs that create the irregular cycles, the hot flashes, and the night sweats. So it's the fluctuating levels of hormones that make people sweat because it's affecting our hypothalamus, which is the thermostat in our brain. Most women think, I'm in perimenopause, I'm having hot flashes, so it must mean that my estrogen's low. That's not necessarily true. As a matter of fact, what we see mostly in perimenopause is estrogen dominance, which is high estrogen and low progesterone. But she's still having hot flashes because she's having these fluctuating levels of hormones, and that's setting off the thermostat. Now, a lot of women will go on hormones during this time and they feel better. They feel better taking estrogen even if their estrogen is high. The reason that's happening is because taking the hormones flatlines your hormone levels so they're not fluctuating as much. I don't recommend that people who have high estrogen be taking estrogen because that can proliferate fibroids, cysts, endometriosis, and it can predispose you to breast cancer. So it's very important to deal with the fluctuating levels of hormones and not just be taking outside hormones during this time. Other common symptoms that happen during perimenopause are anxiety, depression, and insomnia. I see this so much. As women move into their 40s, they start not feeling themselves anymore. They start to feel apathetic, a loss of interest in things they used to be interested in, fatigue, exhaustion. They can also feel symptoms of anxiety like a sense of impending doom, mind racing, worrying that something bad is going to happen. They can't turn off the engine in a way. Insomnia is also common during this time, either having a hard time falling asleep or staying asleep. These symptoms of fatigue, anxiety, depression, insomnia, often they get blamed just on the hormones. And even though the hormone levels fluctuating can cause these symptoms, one of the other common things that causes these symptoms to be very popular during perimenopause is issues with the thyroid and the adrenal glands. Very many women are moving into their 40s with compromised thyroid and compromised adrenals from toxins in the environment, from inflammation, from poor diets, and from go, 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 never recharge. And it's the imbalances in the thyroid and the adrenals which are producing a lot of the symptoms of anxiety, depression, and insomnia. So just taking hormones doesn't really fix the root cause of the problem. The adrenal glands produce adrenaline, dopamine, norepinephrine, cortisol, serotonin, GABA, and you've heard of that whole host of chemicals. So what's important during perimenopause, if you're having these symptoms, is to make sure you get a thorough blood workup, having your estrogen, progesterone, testosterone, FSH, and LH tested. But it's also important to have your doctor do a thorough thyroid test, look at your adrenals and your neurotransmitters and your blood sugar, and really get to the root of what's causing your symptoms and not just putting the hormonal band-aid on it. What are the symptoms associated with menopause? So when a woman moves into menopause and her ovaries shut down, basically she should have the same hormone levels throughout the entire cycle. So there's no more fluctuating levels of hormones. In the early phases of menopause, when the hormone levels are still fluctuating a little bit, because there's still a little bit of energy in the ovaries, she may still get some hot flashes and night sweats and feel discomfort in her body that way. The other symptom of menopause is that a lot of times women will feel fatigue, anxiety, depression, and insomnia. Sometimes these are coming from low levels of hormones. As I told you, the hormones should be 20% of what they were before, and often if your thyroid and adrenals aren't working, they're not in that 20% range. But many of these symptoms are coming from the thyroid and the adrenals being depleted because they are producing the hormones that you need for your second phase of life. So when you're in menopause, it's very important to make sure that your backup generators, the thyroid and the adrenals, are working well, and get them tested so that you can have that proper balance throughout menopause. During menopause, it's very important to keep those hormones in balance. Otherwise, we will have issues with bone density, heart health, brain health, issues with memory. And of course, there's the things in our beauty that we don't like, signs of aging, which is wrinkles and saggy skin, hair loss. So it's very important to keep your body in balance so you don't experience those symptoms during menopause. But I must say, for the most part, once you're fully in menopause and the hormones aren't fluctuating anymore, it's a time of freedom from a lot of those symptoms, which are mostly common during perimenopause. During perimenopause and menopause, there's often some other symptoms related to vaginal dryness, decreased libido, a feeling like you're having a urinary tract infection. And these are mostly coming from the decreased levels of sex hormones, estrogen, progesterone, and testosterone. Testosterone really affects our sex drive, makes us interested in sex, and the estrogen and progesterone really plump up the vaginal tissue and make it moist. So it's when those levels decrease that we'll often see vaginal dryness. The symptom of like you feel like you're going to have a UTI, that's also coming from the decreased levels of hormones because the vaginal tissue starts to degenerate. And it is easier to get UTIs, but a lot of times it's a symptom of feeling like you have a UTI or feeling like you have a vaginal infection when actually it's actually the atrophy of those tissues. So this is a time where many women will be prescribed vaginal estrogen or progesterone creams so that they can help to plump up that tissue if your hormones are too low and help to relieve some of the symptoms of vaginal dryness, decreased libido, and a feeling like you have a UTI or a vaginal infection. One of the most common complaints I get during people's 40s and 50s as they're moving through perimenopause and menopause is weight gain. They feel like the minute they turn 40, their body changes. Their waist becomes wider, they become more bulky, they have back fat, and even when they change their diet and exercise, they're not able to lose weight the way they used to. So of course they blame it on the hormones. The hormones are a part of weight gain during perimenopause and menopause because if the hormones are dropping very rapidly, the body wants to hold on to the hormones and it stores them in fat. So it holds on to the fat as a way of holding on to hormones. But the other things that cause weight gain during perimenopause and menopause are dysregulated blood sugar, creating an insulin resistance or something known as the metabolic syndrome. This is very common in our culture, and we'll see higher blood sugar levels, higher cortisol, and people will gain weight right around their belly. And so that needs to be kind of corrected and balanced with diet, lifestyle, sometimes supplements or medications to correct the blood sugar dysregulation. Another cause of weight gain during perimenopause and menopause is that the thyroid and the adrenals are not actually working. The thyroid and the adrenals help us to burn fat. They regulate our metabolism and our energy. And when they're depleted, we're not able to burn fat and burn calories the way we used to. So instead of just taking hormones during perimenopause and menopause as a way of regulating your weight, you have to really get to the root of what is actually causing your weight gain. Is it diet and lifestyle? Is it that you're exercising less? Or is it because you have a blood sugar problem, a hormone imbalance, or issues with your thyroid and your adrenals? So getting to the root of the problem is important instead of just putting band-aids on the symptoms. There's many symptoms and syndromes that are associated with perimenopause and menopause, and as I've told you before, they're common but not normal, and it's important to get to the root of what's causing them. Some of the things are actually signs of underlying other diseases that might be going on that are just showing up in your 40s and 50s. So it's important to consult with your doctors and get to the root of these problems and not always blame everything on the hormone changes. Some of these symptoms are heart problems, heart palpitations, racing heart. Of course, you want to see your cardiologist. Blood sugar dysregulation could be coming from dysregulated blood sugar and insulin, poor diets, lack of exercise. Sometimes we see issues with bone density. The bone density problems could be coming from your hormone levels going down. They can also be coming from not getting enough calcium and minerals in your diet, or it could be coming from a problem with your parathyroid gland. Weight gain, we associate that with hormones often, but often it's related to thyroid, adrenals, and blood sugar. And so there's so many symptoms that people can have. And I think that it's very important as you move into your 40s and 50s to have basic checks with your doctor. Get your full blood workup and have your yearly exam. This is also the time to get your yearly exam with your gynecologist and have them check everything out and do an ultrasound to make sure there's no fibroids, cysts, or endometriosis, but also to have a mammogram every year as directed by your doctor to make sure there's no beginnings of breast cancer starting, any kind of fibroids in the breasts or fibrocystic breasts. It's also important to have a check-in with the cardiologist and make sure that your heart is working well, because as we know, silent heart disease is very common in women as they move into their 40s and 50s. There's other symptoms people can have that are more neurological: numbness and tingling, problems with their brain function and their memory. Sometimes people get disoriented. Sometimes this is related to the hormones and the hormone changes, but sometimes it's related to more neurological things. So when these things are coming up, don't just blame everything on the hormones. Make sure you're getting thorough workups by the proper medical doctors to make sure you're getting to the root of the problem and ruling out other serious things that could be happening during this time. Now I'm going to talk about perimenopause and fertility. 25% of my practice is fertility, and believe it or not, most of those patients are in perimenopause or the 10 years before menopause. And for many of these women, they can still get pregnant. It may be a little bit more difficult, but a lot of them can still get pregnant, especially in those earlier years. And so what do we look at? What are some of the things that may be causing some of the difficulties for women during this time? First of all, the egg number might be dwindling a little bit, and that can be seen by looking at your FSH, LH, and the AMH. Sometimes the egg quality is going down just because of the exposure of time and toxins to those eggs. The other thing is that often women are very low in progesterone. Most women are low in progesterone after the age of 35. And so even though they could be getting pregnant every month, it may not be implanting. Another common thing that I see is that often a woman's uterus is tilted or out of alignment. So every month, instead of all that old blood cleaning out, a lot of times it's folded forward, anteflexed, or folded backward, retroflexed, and that blood gets stuck up in there. And if that blood's stuck up in there, it's not a good lining for implantation for the baby. So something that I do to help women with that is something called the Mayan abdominal massage, which is a realignment of the uterus and the ovaries. So when a woman's in perimenopause and she comes to me for fertility, I do a complete workup of all of her blood, check her hormone levels, check her thyroid and her adrenals, and try to get her in as much balance as possible. Sometimes we have to help improve the quality of the egg with different nutritional things. Often we have to help detox her body to create an organic garden for the baby, and that can often help to improve the egg quality. We often have to use some progesterone cream. Some women have to use fertility treatments, and I support them on that kind of journey of fertility treatments, but I still want to try to help get her body as healthy as possible and do everything we can naturally to improve the outcome of those treatments. It's important to know that this is the garden the little baby's going to be growing in. We want that garden to be organic and not full of any toxins. Secondly, we want to improve her egg quality, and we can do that with different nutritional supplements and herbs. And then we want to keep her hormones in balance, and do that. Sometimes the doctors will use medications, estrogens, progesterones, and sometimes you can do it using herbs. And often we have to do the uterus treatment, which is the Mayan abdominal massage, to correct the uterine alignment. So to break it down again is that most women are still fertile, especially in their early stages of perimenopause. It just might take a little extra work, but it can be done, sometimes alone and sometimes with the support of medical clinics. Women in perimenopause have similar hormone levels to a girl that is prepubescent or in her early stages of just getting her period. Her hormone levels are fluctuating wildly. And in perimenopause, those levels start to fluctuate wildly too. So that can create a lot of the emotional ups and downs, the mood swings, and just the feeling of being dysregulated. Those hormones are very, very powerful. So if you remember how you felt when you were just starting to get your period and how emotional you were and how unstable you sometimes felt, that's how you're feeling now. And that's because of this wild kind of up and down in the hormone levels. So hang tight. It's like a roller coaster, but we can get through this together. Once a woman's fully in menopause, her FSH and LH are very high, and her estrogen and progesterone are quite low. And those hormones are the same all the time. A menopausal woman's hormones are very similar to a 7 or 8-year-old girl before she started to become prepubescent. And if you remember that 7 or 8-year-old girl, she's very free. She doesn't really care what people think about her. She's very creative, spiritual. And so one of the things that's very fun to look forward to for women in menopause is that freedom associated with the new levels of hormones, the FSH and LH being high and the estrogen and progesterone being low, where there is a sense of freedom, not caring what people think about you, and just being much more creative and spiritual. So it's something to look forward to, and I love telling women that you're actually becoming younger as you get older. You're becoming a queenager. Thank you so much for joining me on your journey through empowered menopause. I hope you're feeling much more informed, supported, and inspired to embrace this transition with confidence and clarity. Make sure you subscribe to my channel so you can continue to get all the videos in this series, where we will continue to explore powerful and meaningful ways to empower you on the midlife transition and beyond. Your transformation is just beginning, and I'm honored to walk this path with you. I look forward to seeing you in the next video.